Hi everyone, Dr. Kyle back with you again, and today I want to talk specifically about a condition that many new parents are familiar with, unfortunately, and that is colic. It's estimated that 20% of children under the age of 4 experience colic. If you're unfamiliar with that is, that's excessive gas built up in the GI tract, and it causes the child to be really crying and inconsolable. And really the devastating part of this is not only does it affect the child's health, but because they're so difficult to console, and this can happen throughout any time of the day, including the night, oftentimes this has a huge detrimental effect on the parent's health. Not only are they stressed out because they're worried about their child and the pain that they're going through, but they're physically losing sleep, trying to comfort this child, and oftentimes they feel like there's nothing they can do. And so, of course, they go to the most traditional route. Most people would go to their pediatrician, rightfully so, looking for an answer. Now, here's what we know about colic. Number one, like I said, it is an increase in gas in the GI tract. It generally happens 3 or more hours per day. It can happen any time of the day, whether it's midnight, noon, or in the afternoon, morning. There really is no pattern, but as the child has it more and more, it does start to fall into a pattern for that one specifically, so it does become somewhat predictable. If you take your child to the pediatrician and they encounter a case of colic, most likely they're going to be given a medication to manage that. And the most common one that's given out at this time or prescribed at this time is dimethicone. Now, dimethicone can be beneficial or help with the symptoms of colic. However, here are the side effects of this: fatigue, sedation, blurred vision, appetite loss, constipation, even nausea and headaches in children. And the really amazing thing is that even on the label by the maker, on their own warning label, it says not to be used if they're under the age of 6 months, which is when most of the children have it, is around that 4-month mark. So even against the maker's own studies and safety procedures, this is the most common medication that's given out. It's called dimethicone. Now, every medication has side effects, and you need to make that decision as a parent whether you're willing to accept that for the relief of the child. And when you're holding a screaming child, I can understand why that decision is made to give it. But there are other options, and I want to go through some of those with you. First and foremost is chiropractic care. That young child, his nervous system or her nervous system is controlling digestion just like it is as an adult. And so if there's a subluxation or a pinched nerve affecting the function in the digestive tract, most commonly in the thoracic or mid-back, it doesn't allow the gas to move through and it builds up, or it can affect the stomach's ability to break down food, which then creates the gas and starts the problem farther up in the system. So the first thing to do is to be evaluated by a good chiropractor to make sure that there's not something going on in the child that can be easily corrected physically to take pressure off and allow that body to function and heal the way it should without any input. Now, chiropractic is the first, but for some people that may not be the most available or the best option for where they're at in life, but chiropractic should be where you send someone first. Secondly, though, if you're looking for things outside of chiropractic, there's a product called Gripe Water, and that's a term that's used to water the concoctions that have herbs and oils in them that help to soothe the stomach and soothe the digestion. Now, this is something to watch out for because some of the commercially available ones do have sugar or even alcohol in them. So just like anything, you need to make sure you read the label to know what's going into the child's body. There is one called Colic Calm that is an FDA listed one. So if you're looking for one that has the FDA, I'll say approval, or the FDA somewhat regulated, it's called Colic Calm. The other thing you can do as a mother that's maybe breastfeeding the child, if you are breastfeeding, look at taking a good probiotic for that child. Remember, that child is getting all of their nutrients from you at that age if you're breastfeeding, and so it's also building its gut flora through you as well. And if you're lacking some of the important gut flora bacteria that's needed, the child is going to be lacking as well. Specifically, the bacteria that you would want to look for on a good probiotic would be called Lactobacillus reuteri, R-E-U-T-E-R-I, Lactobacillus reuteri. Now, this one's I should say it this way, it doesn't resolve everything. Most studies show that by taking this, we see up to about a half hour to an hour, somewhere averaging around 45 minutes, less crying each day. So again, it doesn't completely solve the problem like removing the subluxation on the nervous system would, but it does offer some relief. And those 45 minutes, of course, can be huge for the child and the parents. So there are other options out there for colic. And I just want to spread this word. If you know somebody, or you yourself are a new parent that's going through this with a child, please know that there are options beyond a pill bottle for that child. The decisions that are made at this stage have lifelong effects on their health, and anything you can do to be more natural or more holistic but still effective, most importantly, is going to really set that child on the proper route in life and not start a path of side effects and reliance on medication or chemicals. So again, if you know somebody or you yourself are dealing with this, take these steps, find a chiropractor, look at Gripe Water, and make sure you read the ingredients. And if you're breastfeeding, look at a proper probiotic in order to address this. If you'd like to share this information or video with somebody, please do. You never know whose life you can change. And especially a new parent that's not sleeping will be eternally grateful if you can help them with this. Have a wonderful day. I can't wait to see you again soon.